Our 546, for most of the holidays are some of the most joyous times of the year spent with friends and family. But for those who struggle with mental health, it can also be a very triggering time.
Yeah, mental health experts say depression, stress, sadness, and anxiety all go hand in hand with the holidays, and sometimes it's something that you need to be cognizant of, especially with Thanksgiving now just happening tomorrow.
That's right, and let's bring in our Danny Travis. She's joining us live in studio. Danny, sat down with one local psychiatrist ahead of the holiday weekend. What can people struggling with these symptoms look out for?
Yeah, Matt, Steph, good morning, and that's right, local psychiatry specialist and Dr. Elssy Oms says this is known as seasonal affective disorder, something she says impacts up to 1.5% of residents statewide over the holidays. But with Thanksgiving tomorrow, like you guys just said, the stress that comes from family reunions and large gatherings all weekend can be major triggers for some. Dr. Oms says it's a time people tend to put other people's needs above themselves because of expectations society places surrounding Thanksgiving. This can be from spending too much money on food to meal preparations or trying to please everyone around the table. Oms says Thanksgiving can also be a time of grief and sadness,
because our minds tend to wander to either other times in our life that we miss, and sometimes we miss friends and loved ones that we no longer have in our life. It can also be a time where biologically we see changes in our body because we stop our routines, we forget to do things like exercise and go outside, and lack of exposure to sunlight can sometimes trigger also symptoms of depression or anxiety.
Says instead of numbing the feelings with alcohol or avoiding it altogether, it's more important to recognize and express those feelings to yourself and those you trust. And by doing this, she says you can practice what psychiatrists call mindfulness,
which is bringing your mind to the present moment, to ask yourself why you're doing what you're doing and why is it important and who it is important to. So that can calm you. You can prepare for difficult topics that you're going to be probably approached by a family member or friends that you may not want to approach or discuss during this time.
Dr. Oms says over the holidays, the two hospitals she works at tend to see the highest number of children's psychiatric patients seeking help. If you or a loved one is struggling with this, we posted ways to get help on our website, CBS12.com. Matt, Steph, back to you.
Danny.